Right now, in medicine cabinets all across America, there are pills sitting next to the toothpaste that most people would never guess are connected to memory loss. Some are prescription, some you can grab off a shelf at any pharmacy without even talking to anyone. And research published in one of the most respected medical journals in the world found that people who use certain common medications daily for 3 years or more had a nearly 50% higher chance of being diagnosed with dementia compared to people who didn't. 50%. Sit with that for a second, because in a moment, I'm going to tell you exactly which medications that research is talking about, and I'd bet money that at least one of them is in your house right now. But first, I want to tell you about a woman I'll call Linda, because her story is the reason I made this video. She was in her 70s, sharp as ever, still doing the crossword every morning, still remembered every grandchild's birthday. And then, over about a year and a half, something shifted. She started walking into rooms and forgetting why. She missed 2 doctor's appointments in the same month. One afternoon, she got turned around driving home from the grocery store, a route she'd driven 1,000 times. Her daughter assumed it was just age catching up with her. What nobody thought to check for months was her medicine cabinet. She was taking an over-the-counter sleep aid every night, a bladder medication during the day, and an old prescription for anxiety she'd been on for years. When her doctor finally reviewed the full list together, several of those medications were quietly working against her memory the entire time. That's the video I want to share with you today. Not to scare you, I want to be very clear about that up front, but to give you something a lot of people never get, which is a clear, honest look at medications that research has linked to memory changes in older adults, so you can walk into your next doctor's visit with better questions. Stick with me, because number 4 surprised me when I first read the research, and the very last point on this list ties everything together in a way most videos like this never explain. If you're the kind of person who wants simple, trustworthy health information that can help you or someone you love stay sharp and independent for years to come, this is exactly what this channel is for, so go ahead and hit subscribe to Prime Health Insight. We put out new videos regularly, and I promise you, none of them are here to frighten you. They're here to help you feel more in control of your own health. Before we go any further, I want to set the tone for this entire video because it matters. Nothing you're about to hear means any of these medications are bad, and nothing here should make you stop taking anything you've been prescribed. Every one of these medications helps millions of people every single day. What we're talking about is risk, not certainty, the difference between this might raise the odds and this will happen to you. Big difference. And almost every medication we cover today has safer alternatives or simple adjustments your doctor can consider. Think of this as preparation for that 15-minute appointment where you're sitting across from your doctor with your list of questions ready instead of nodding along and hoping you remember to ask later. So this video is really 2 things at once. It's information and it's a tool to help you have a smarter, more specific conversation with your physician or your pharmacist. That's the whole goal. Let's talk about why medications even affect memory in the first place. Because once you understand this one idea, the rest of the video will click into place fast. Many medications work by blocking a brain chemical called acetylcholine, which is deeply involved in memory, learning, and attention. Drugs that do this are called anticholinergics, and it's a bigger category than you'd think common medications sitting in bathroom cabinets across the country right now. Think of it like coffee. 1 cup in the afternoon won't keep you up all night, but 3 or 4 cups every day for years adds up in a way 1 cup never would. Researchers believe something similar happens here. It's rarely one dose on one day that matters. It's the slow buildup over years, what doctors call anticholinergic burden. And because these medications are usually taken quietly, without much thought, most people never stop to add it all up. That's exactly what we're about to do together, starting right now with the one that surprises people the most. Picture yourself standing in the pharmacy aisle, scanning the shelf for something for allergies or for a restless night. The bottle a lot of people reach for is number 1 on this list, and honestly the one that surprises people the most, diphenhydramine. You probably know it by its brand name, Benadryl. It's also the active ingredient in a lot of nighttime cold medicines and over-the-counter sleep aids with PM in the name. Here's why it became so popular. It's cheap, it's available without a prescription, and it works fast for allergies and for helping people fall asleep. Millions of older adults take it several nights a week without ever thinking of it as a real medication, because you don't need a prescription for it. But diphenhydramine is one of the strongest anticholinergic drugs available over the counter. Research published in JAMA Internal Medicine, one of the most respected medical journals in the world, has found that people with long-term, frequent exposure to strong anticholinergic medications had a meaningfully higher risk of developing dementia compared to people who rarely or never use them. That research looked at large numbers of patients over many years, and diphenhydramine falls squarely into that strong anticholinergic category. The American Geriatric Society actually lists it on what's called the Beers criteria, a well-known guide of medications that are generally considered risky for older adults, specifically because of effects like sedation, confusion, and memory problems. If you or someone you love reaches for Benadryl or a PM sleep aid most nights, that's worth a conversation with your doctor about safer alternatives for allergies and for sleep. I want to paint a picture for you because this is often how it plays out in real life. Picture a man in his late 60s. He's had seasonal allergies his whole life, so every spring and fall he takes an antihistamine, and most nights, because it makes him drowsy, he also takes it to help him sleep. He's been doing this for 15, 20 years. Nobody ever told him to stop. His allergy doctor knows about the allergies. His primary doctor might not even know he's taking it nightly for sleep, because in his mind it's just Benadryl, not a real medication he needs to report. That's the exact blind spot researchers are trying to bring attention to, not because the occasional dose is dangerous, but because years of nightly use quietly adds to that cumulative burden we just talked about, without ever showing up as a single alarming event. And here's the thing. Number one isn't even the medication that affects the most people on this list. Number two might be sitting in your bathroom right now, too. Remember Linda, the woman from the start of this video? One of the 3 medications quietly working against her memory was for this exact condition. Number 2, and this one affects an enormous number of women and men in their 60s, 70s, and 80s, is a class of drugs called bladder antimuscarinics, used to treat overactive bladder. Medications like oxybutynin and tolterodine fall into this group. They became popular for an obvious reason. Overactive bladder is uncomfortable, embarrassing, and disruptive to daily life. And these drugs genuinely help. But they work by blocking the same acetylcholine pathways we just talked about, the same large-scale research out of the University of Nottingham that we mentioned a moment ago, specifically identified bladder antimuscarinics as one of the drug categories with the strongest association to increased dementia risk, alongside anticholinergic antidepressants and antipsychotics. If this is you, please don't panic and please don't stop your medication today. What I'd encourage instead is asking your doctor about newer bladder medications that don't cross into the brain the same way, or about non-drug approaches like pelvic floor therapy, which many people don't even know exists as an option. I hear from viewers all the time who say the same thing. They were so relieved to finally get their bladder symptoms under control that they never thought twice about what the medication might be doing elsewhere in the body. And that's completely understandable. Overactive bladder can be embarrassing enough that people stop going out, stop visiting grandchildren, stop feeling like themselves. Nobody should have to choose between comfort and cognitive health without at least knowing there might be another path. That's really all this video is asking you to do: know that a path exists and ask about it. Number 3 is a group of older antidepressants called tricyclic antidepressants medications like amitriptyline. These were some of the first antidepressants ever developed, and doctors still prescribe them today, not just for depression, but often for nerve pain, migraines, and sleep. That's actually part of why they're still so common. They're useful for more than one condition. But they carry a strong anticholinergic effect, and they show up repeatedly in the research we've been discussing as one of the medication categories most consistently linked to increased dementia risk in older adults. If you're on one of these, know that there are often newer antidepressants and nerve pain medications available today that don't carry the same cognitive concerns. That's a conversation worth having, especially if you've noticed any changes in your memory or focus. If you've made it this far, you already know more than most people watching videos like this ever bother to learn. But stay with me, because what's coming next is the one I get asked about more than anything else, and the honest answer isn't what you'd expect. Now here's where I want to slow down for a second, because number 4 is the one that genuinely surprised me when I dug into the research, and I think it will surprise you too, mostly because the answer isn't as simple as the first 3. Number 4 is benzodiazepines. Medications like diazepam, alprazolam, and lorazepam, commonly prescribed for anxiety and sleep. Remember that old anxiety prescription Linda had been on for years? This is the category it belonged to. For years, headlines have linked these drugs to dementia risk, but the highest quality, most recent research tells a more complicated story than the headlines let on. A large 2024 study out of the Netherlands, published in BMC Medicine, found that overall benzodiazepine use was not clearly linked to a higher risk of dementia once other health factors were accounted for. It did find that long-term use was tied to faster shrinkage in brain regions involved in memory, which is worth taking seriously on its own. Other studies have shown similar modest associations that fade once you control for the fact that people taking benzodiazepines often already have anxiety or depression, conditions separately linked to dementia risk. So which is it? I promised you honesty over headlines, and here's the honest answer. The evidence on benzodiazepines and dementia is genuinely mixed and still evolving, and anyone who tells you it's settled either way isn't being fully straight with you. What isn't mixed is that these medications are well known to cause falls, confusion, and dependence in older adults, and most geriatric guidelines recommend using them cautiously and briefly rather than long-term. So even without a settled answer on dementia risk specifically, this is a category worth revisiting with your doctor if you've been on it for years. Have you ever laid awake at midnight, finally given up, and reached for something from the medicine cabinet just to get some rest? Number 5 brings us to prescription and over-the-counter sleep medications more broadly, beyond what we've already covered. This includes some of the newer Z drugs like zolpidem, as well as sedating antihistamines used purely for sleep. Sleep problems are incredibly common as we get older, and it makes sense that people want relief. But here's something a lot of people don't realize. Poor sleep itself is also being studied as a possible contributor to cognitive changes over time, which creates a frustrating trap. The medication meant to fix the sleep problem can bring its own cognitive side effects, especially with regular long-term use, while the underlying sleep issue may still not be properly addressed. This is exactly the kind of situation where non-drug approaches, like cognitive behavioral therapy for insomnia, which has strong research support and is often covered by insurance, can be a genuinely powerful alternative worth asking your doctor or a sleep specialist about. I know sleep is one of the most personal, frustrating struggles for a lot of people watching this. Lying awake at 2 in the morning, watching the clock, dreading how exhausted you'll feel tomorrow, of course you want relief. And of course, a pill that works feels like a gift. I'm not here to take that away from you. I just want you to know that if you've been on the same sleep medication for years without ever revisiting it, that's a completely reasonable thing to bring up at your next appointment, especially if you've noticed any fogginess or memory slips during the day. If you're finding this useful so far, do me a favor and tap that like button. It genuinely helps this information reach more people who need to hear it, and it only takes a second. Let's pause for just a second. We've covered an over-the-counter allergy medicine, a bladder medication, an old-style antidepressant, and anxiety medication. Be honest with yourself for a moment. How many of those sounded familiar so far, either for you or for someone you love? Hold that thought, because we still have 4 more ahead, and they include a category most people never expect to see on a list like this. Number 6 is a class of medications called antipsychotics. Now, I want to be careful here because antipsychotics are essential, life-changing medications for people managing conditions like schizophrenia or bipolar disorder, and nothing here is a criticism of using them for those purposes. What the research has raised concern about is a different, very common situation: antipsychotics being prescribed off-label in low doses to older adults for agitation, sleep problems, or behavioral symptoms, sometimes in the context of early cognitive decline itself. The FDA has issued warnings about antipsychotic use in older adults with dementia-related behavioral symptoms specifically, and the same large anticholinergic studies we've referenced throughout this video identified antipsychotic medications as one of the categories associated with increased dementia risk. If a loved one has been prescribed an antipsychotic for agitation or sleep, rather than for a primary psychiatric diagnosis, that is absolutely worth a direct conversation with their doctor about whether it's still the right fit and for how long. I know that conversation can feel scary if it's your own parent, especially if they seem calmer on the medication than they were before it. But calmer isn't always the same as better, and asking the question doesn't mean taking anything away, it just means making sure it's still the right tool. We're not done yet, and the next two are ones almost nobody talks about, even though together they might matter more than any single medication on this list. Number 7 is a category that often hides in plain sight: gastrointestinal antispasmodic medications, prescribed for conditions like irritable bowel syndrome, along with certain older anticonvulsant medications that also carry anticholinergic properties and are sometimes used for nerve pain or seizure control. These are less talked about than the others on this list, but they belong to the same broad anticholinergic family we've been discussing, and they add to that cumulative burden I mentioned earlier. Individually, the risk from any one of these may be small, but hold on to that word cumulative because it's about to matter more than almost anything else in this video. Number 8 is opioid pain medications drugs like oxycodone and hydrocodone, commonly prescribed after surgery, for injuries, or for chronic pain conditions like arthritis. Opioids work differently than the anticholinergic drugs we've discussed, but they affect the brain in their own way. And research has consistently shown that opioids can cause confusion, sedation, and short-term memory problems, particularly in older adults, and particularly when combined with other sedating medications. The concern grows significantly with long-term, high-dose use, and there's ongoing research into whether long-term opioid use is associated with a higher risk of cognitive decline over time. If you're managing chronic pain with opioids, this isn't a suggestion to stop chronic pain itself. It takes a real toll on quality of life, and even on the brain, and untreated pain is its own serious problem. It's simply a reason to make sure your pain management plan is being reviewed regularly and that your doctor knows about every other medication you're taking alongside it, especially anything sedating. This is also a good moment to mention something families often notice before the person taking the medication does. If a parent or spouse on pain medication seems unusually foggy, seems to be repeating questions, or seems not quite themselves shortly after starting or increasing a dose, that's worth mentioning to their doctor sooner rather than later. Sometimes what looks like early memory decline is actually a medication effect that improves once the dose or combination is adjusted. That distinction matters enormously, and only a healthcare provider can sort it out. Which brings us to the final point, the one I promised you at the very start, the one that ties everything on this list together, and honestly, the one most doctors never take the time to fully explain. Number 9 isn't a single medication at all. It's a situation called polypharmacy, the simple fact of taking multiple medications at the same time, which becomes increasingly common as we get older. Picture one of those weekly pill organizers with the little compartments for each day. For a lot of people watching this, that box is full. And here's what the research shows clearly. It's rarely just one pill causing a problem. It's the combined, cumulative, anticholinergic and sedative load of several medications stacking on top of each other, sometimes prescribed by different doctors who don't have a full picture of each other's prescriptions. That's exactly what happened to Linda. No single medication in her pill organizer was the whole story. It was 3 of them, stacked together for years. The same JAMA internal medicine research we referenced earlier found that risk increased along a dose-response relationship. The more cumulative anticholinergic exposure a person had over time, the higher their associated risk appeared to be. This is precisely why one of the single most valuable things you can do for your brain health at any age, but especially past 60, is a comprehensive medication review, sometimes called deprescribing, when medications are safely reduced or adjusted. Bring every bottle, prescription, and over-the-counter to your doctor or pharmacist once a year and ask them to look at everything together, not one condition at a time. This one habit, more than almost anything else on this list individually, is what the research suggests can make a real difference. Here's a simple way to think about a medication review, so it doesn't feel intimidating. You're not walking in to accuse anyone of doing something wrong. You're simply asking a question that's completely reasonable to ask. Looking at everything I'm taking together, is there anything here that could be simplified, reduced, or swapped for something gentler on my brain? given my age? Pharmacists in particular are an underused resource here. Many are trained specifically in exactly this kind of cumulative medication review. And in most states, you can ask for one without even needing a separate doctor's appointment. Some pharmacies offer it as a free service. It's one of the most overlooked tools available to you, and it takes maybe 20 minutes. I also want to say something to the caregivers watching this, because I know a lot of you are here on behalf of a parent rather than for yourselves. Think about the last family dinner where you sat across the table from them. You're often the one person who can see the full picture that no single doctor sees: the specialist who prescribed the nerve pain medication, the primary doctor who prescribed the blood pressure pill, the urologist who prescribed the bladder medication, and the over-the-counter sleep aid nobody thought to mention to anybody. Bringing that complete list to one appointment, written out clearly, is one of the most powerful things you can do for someone you love. It's not glamorous, and it won't feel like a big dramatic gesture, but sitting down for 20 minutes to write out every bottle in that medicine cabinet could genuinely be one of the most protective things you do for their brain health this year. Now, before we close out, I want to answer the question I know some of you are thinking right now, which is, how worried should I actually be? And I want to give you an honest, grounded answer. Association is not the same as certainty. Almost none of this research proves that any single medication directly causes dementia in any individual person. What it shows is a pattern across large groups of people, that certain medications appear more often in people who go on to develop memory problems, especially with heavy long-term use. Genetics, overall health, physical activity, social connection, sleep quality, and dozens of other factors all play a role in brain health too. Medications are one modifiable piece of a much bigger picture, not the whole picture. That's actually the hopeful part of this video. Because it's modifiable, it means you have some real power here. You can ask questions. You can request a medication review. You can bring a written list to your next appointment. None of that requires you to be a doctor. It just requires you to be an informed, engaged patient, which, if you've watched this far, you clearly already are. So here's what I'd love for you to do right now, while this is fresh in your mind. Drop a comment and tell me your age and roughly how many prescription or over-the-counter medications you take regularly. I'd also love to know, have you ever noticed a change in your memory or focus after starting a new medication? Or have you ever sat down with a doctor or pharmacist specifically to review everything you're taking together? I read these comments, and I promise you, sharing your experience helps other people in this community who might be dealing with the exact same thing and don't realize it's worth asking about. And if you have a parent, a spouse, a sibling, or a friend who's juggling several medications the way Linda was, please consider sending this to them. Not because it's frightening, but because it might genuinely help start a conversation that leads to a safer, clearer medication list, and possibly even catches something before it becomes a bigger problem. That's really the whole point of a video like this, not to create fear, but to hand you a tool you didn't have 20 minutes ago. Here's what I want you to walk away with today. Memory changes are not something you simply have to accept as an unavoidable part of aging, and they're not something to face without information. Some of what affects your memory is out of your hands, but some of it, including exactly what's in your medicine cabinet, is absolutely something you can take a closer look at, ask better questions about, and work through together with the people who care for your health. That's empowering, and it's something you can act on starting with your very next doctor's appointment. Thank you so much for spending this time with me today. If this video gave you something useful, subscribing to Prime Health Insight means you won't miss what's coming next. And I think you're really going to want to see it. We're going to be talking about the everyday habits, well beyond medication, that current research links to a lower risk of memory decline, including a few surprisingly simple ones that most people completely overlook. I'll see you in that one. Take care of yourself and take care of that memory of yours. It's worth protecting.